Hello doctors, welcome back. In the lecture series of Osteology of Upper Limb, in the previous lecture we have discussed the osteology of the scapula bone, clavicle bone, the humerus bone and the radius bone and the ulna bone. Today in this video lecture we will discuss the osteology of bones in the wrist region and the hand region. Students, the bone in the wrist region are the carpal bone, while the bones in the hand regions are metacarpal bones and the phalanges. So first we will discuss the osteology of the carpal bone. Students, carpal bones are the articulating bone. They are the group of articulating bones that form intercarpal articulation. They are total 8 in number and divided into two groups or two rows, the proximal and the distal. As name indicates, the proximal group of bones will lie proximally and the distal groups of bones will lie distally. So the bones present in the proximal row these bones are scaphoid, trapezoid, lunate, triquetrum and pisiform. Now the bones present in the distal row, these bones are trapezium, trapezoid, capitate and hamate. A simple mnemonic to learn these bones in order is she looks too pretty, try to catch her. So we will consider the first letter of the each word. Here S will match the scaphoid, L will match lunate, T will match the triquetrum and P will match the pisiform. So these four bones form the proximal row. Now moving forward, this T will trapezium again T, trapezoid, C, capitate, and H, hamate. Now student, as you can see, this region here, this is called the wrist region, and these are the carpal bone. So this bone here located most laterally is the scaphoid bone. Then we have lunate bone, which is followed by triquetrum bone. Here this is the triquetrum bone, and this small bone here, this is called pisiform bone, which is located most medially in the proximal row. So the proximal row is formed by these four bones: scaphoid bone, lunate bone, and this is the triquetrum bone, and this is the pisiform bone. Now in the distal row we have trapezium bone, and this is the trapezoid bone, and this is the capitate bone, which is the largest bone among all the carpal bones, and this is the hamate bone, which is located in the medial. So the carpal bones are arranged in the two rows, proximal rows and the distal row. The proximal row has 4 bones, and the distal row also has 4 bones. A simple mnemonics to learn these bones is she, scaphoid, look, lunate, 2, triquetrum, pretty, pisiform, tri, trapezium, 2, trapezoid, and catch, capitate, her, hamate bone. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. These all are the 8 bones of the carpal region. So students, the carpal bones proximally form articulation with the radius bone of the forearm, and distally it form articulation with the metacarpal bones of the hand, forming the metacarpal carpal joint. Now students, moving toward the bones of the hand region. In the hand region we have metacarpal bones and the phalanges bone. We have first metacarpal bones. The metacarpal bones are 5 in number, and they are named as first, second, third, fourth, fifth, from lateral to medial order. This means the one bone that is located the most laterally is the first metacarpal bone, and the bone that is located the most medially will be the fifth metacarpal bone. Also, these bones has we will also see in the skeleton diagram that these bones has base, body, and head. The base, the most proximally part of the metacarpal bone, is called the base bone, which is followed by the body, and the body is anteriorly in concave shape. The head is the most distal part. Now we will see in the skeleton diagram. Here you can see this is the most lateral part of the hand. So this bone here, this will be the first metacarpal bone, and this will be the second metacarpal bone, this will be the third, and this will be the fourth, and the most medially will be the fifth metacarpal bones. As you can see, the most proximal part here, this is called the base of the metacarpal, which articulate with the carpal bones, which is followed by the body of the metacarpal bone. And as I have said, the body of the metacarpal bone is in concave shape. As you can see here, this form here the concave shape. Then the distal part of the metacarpal bone is called head, and the head of the each metacarpal bone articulate with the first phalanges of the digit. So this is all about the metacarpal bones. Then we have phalanges bone, which form the digits of the hand. So in total we have 14 phalanges. These form the digits of hands, and they lies most distally of upper limb. It is the most distal part of the upper limb. And the bones has same parts as metacarpals, like base, which is the most proximal part. Then we have body, and then we have head. Also student, the thumb has two phalanges bones, while the rest of the four fingers or digits has three phalanges bones. So this is the thumb digit, and here you can see it is made up of two phalanges bone. Also, as we have studied that the phalanges bone has same base proximally, followed by the body and then head. These phalanges bones are articulated with each other, forming the interphalangeal joints.